Mr. President, I rise today to urge my colleagues to join me in supporting the Comprehensive Addiction and Recovery Act. This is a bill that we have been working on for 3 years. Both Senator Portman, Senator Whitehouse, Senator Klobuchar, I want to thank them for their partnership and leadership on this bill. This is something that the four of us got together on because we saw in our own states the public health epidemic that was happening with our constituents, individuals struggling with addiction, people who were addicted to prescription drugs and overusing and misusing prescription drugs, and then the price of heroin on our streets so low, and people going to heroin, and also a combination of heroin and a deadly drug called fentanyl. So I very much want to thank Senators Portman, Whitehouse, and Klobuchar for the work that we've been doing together over the last several years on this bill. And to see this bill come to the Senate floor, this is a very important piece of legislation that will help us address the public health epidemic facing my home state of New Hampshire and this country. This is something I've come to the floor on several occasions before. And traveling around my state, I can't tell you the number of stories that I've heard from people in New Hampshire and what we're facing, and the number of lives that are lost, the number of lives that are devastated by heroin and fentanyl and the misuse of prescription drugs. This is a life or death issue in my state. The number of drug overdose deaths has been staggering. And before I came to the Senate, I served as Attorney General of our state, and so I worked with law enforcement on these issues, whether it was methamphetamine, cocaine, other illegal drugs, but I've never seen anything like this. As of last week, the Chief Medical Examiner's Office had recorded that there were 420 drug deaths in 2015, and that was a dramatic increase in New Hampshire from the year before. The year before, we had about 320 drug deaths. So this is over a person dying a day in my state. Many more that die in traffic accidents are dying from the drug overdose. And it's a combination, again, of the driver of this, heroin and fentanyl. Fentanyl is 40–50% more powerful than heroin. And when the drug dealers mix it up with the heroin, it's a killer. As Eric Spofford told me, who he himself is an incredible guy who's in recovery, has opened treatment facilities in our state, he got it right when he said fentanyl is a serial killer, because that's what it is. In the month of February alone, there were 14 suspected opioid overdose deaths just in the city of Manchester. 14, just in one city in my state. That is a record high in Manchester, New Hampshire. These are not just numbers that we're talking about here. Behind every statistic is a life that is taken from us far too soon and has been tragically lost. A mother, a daughter, a son, a brother, a neighbor, a friend, a coworker. This hits all of us, and these are people who are being lost from this horrible, horrible epidemic. Behind the statistics and behind the headlines we see every day in the news, there are family members, friends, and communities who have been deeply impacted by this public health crisis. Like the mother from Greenville, New Hampshire, who wrote to me. She spends her days actually doing incredibly important work, helping people who are struggling with addiction. She helps them, and yet she came home and has been coming home to see her own son struggling with heroin. She told me, as I tried to comfort those who have been affected by this tragedy, I think that my son will be next. In Laconia, a man helps those struggling to get treatment, but he feels helpless when they're faced with a 5-month waiting period for a rehabilitation facility. He wrote, in 5 months, these individuals may be dead. A parent from Salem, New Hampshire, contacted me and told me her son is struggling with heroin addiction and she needed help finding a treatment program for him since she couldn't afford to pay for treatment herself. And parents don't know where to go. I've met many parents who want to get help for their kids and they're having a hard time finding a place and knowing where to go. Another mother of 3 children had to revive her son from an overdose before the paramedics could arrive. Or like the Griffin family from Newton, who I've got to know well, who lost their beautiful 20-year-old daughter, Courtney, to an overdose. Now, Courtney's father, Doug, and Courtney's mother, Pam, they've made it their mission to bring awareness to this issue and to make sure that others don't suffer from the same tragedy that they have suffered and the life lost in a beautiful young woman named Courtney, who had so much of life before her and so much potential. Doug and Pam and so many other dedicated people in New Hampshire are working tirelessly to turn the tide against this epidemic. Over the past 2 years, I've made it a priority to travel the state and to hear from our public safety community, treatment providers, addiction experts, families, individuals in recovery about finding effective strategies to address this problem. On ride-alongs with the police and fire, I've been to overdoses. I've seen them bring people back to life, administering Narcan, only to say that they face this every single day. And if we don't focus on prevention and we don't focus on treatment, then the important work that our first responders are doing, then we're not going to get at this problem and make sure people get out of this cycle of addiction that are struggling. Treatment facilities in New Hampshire are certainly working tirelessly, and individuals stepping up to expand our capacity in New Hampshire to support individuals who need help, and they need more support. And I want to take a moment to recognize some of their hard work. Among so many others that I'm grateful, and there's so many working hard together in New Hampshire. Hope for New Hampshire Recovery, Families in Transition Willows Program, the Farnham Center, Westbridge Community Services in Manchester, Gatehouse Sober Community in Nashua, Hope on Haven Hill in Rochester, Bonfire Recovery in Dover, the Granite House in Derry. I've gotten to meet so many incredible people who are dedicating their lives to this. The New Freedom Academy in Canterbury. Visiting these facilities and hearing directly from these dedicated professionals who work there and the work that they're doing. You've got average people coming together, whether to organize a 5K race, to gain resources and support for people who are on the front lines. And this is what they're saying, those who are on the front lines. Tackling this epidemic and reversing the tide of addiction will take a comprehensive, thoughtful approach and include strategies for treatment, prevention, education, support for individuals in recovery, and interdiction. And that's why we have to pass CARA. CARA is important because it embodies the comprehensive approach that so many in my state have told me they need. And here's what it looks like. It gives more support to first responders and law enforcement, expanding the availability of life-saving drugs like Narcan that our first responders are using every day. And because CARA will help make this happen, it's been endorsed by the National Fraternal Order of Police, the National District Attorneys Association, the National Association of Attorneys General, including our own Attorney General, Joe Foster. It strengthens prescription drug monitoring programs to help prevent doctor shopping. This is something I've been advocating for since I was Attorney General of our state, so that our public health officials can have the tools, because we know from SAMHSA research that 4 out of 5 people started with misusing or overusing prescription drugs and then transferred to heroin. And so this is critical. And it increases access to treatment, including evidence-based medication-assisted treatment, helps people have more access. We need to turn the tide. Over 130 stakeholder groups have gotten behind this legislation, groups that are on the front line of this issue. Just to name some of them, it's been endorsed by the National Council for Behavioral Health, the American Psychological Association, the American Society of Addiction Medicine Community, the Anti-Drug Coalitions of America, Harm Reduction Coalition, Faces and Voices of Recovery, Mental Health America, Young People in Recovery, the National Association of State and Alcohol and Substance Abuse Directors, among many others, and I thank these groups for their feedback. It would support additional resources to identify and treat incarcerated individuals suffering from substance use disorders. It would expand prevention, so important that we address prevention. And it would also establish a campaign to bring greater awareness to the association between the overuse and misuse of prescription drugs and what happens as people misuse prescription drugs and then go to heroin and deadly drugs like fentanyl. This bill has overwhelming bipartisan support, 39 bipartisan co-sponsors, and I see my colleague from New Hampshire on the floor. I want to thank her for her sponsorship of this legislation. This crisis does not discriminate. It doesn't care. Heroin, fentanyl, this devastating impact of this drug does not care whether you're a Republican, a Democrat, an independent, whatever your background. This is something that affects all of us. And like the high school student from Manchester who wrote to me, sharing how concerned he is about the negative impact this epidemic is having on his city, when he walks home from school, he sometimes sees discarded needles on the sidewalk, and tragically, he lost his best friend to a fentanyl overdose. Or Abby, who lives in the Seacoast region, who struggled with an opioid use disorder through her pregnancy until she was finally able to receive help and treatment and enter in recovery. And I met Abby, and I'm so inspired by her because she shows us that we can make a difference and we can turn this around. Or a woman in Londonderry who spoke with me at a community forum, terrified that her brother would suffer a reoccurrence as soon as he was released from prison because he wasn't getting the treatment, and she was worried about his path to a successful life with his still suffering from a substance use disorder. Or Angela from Nashua, who has turned her story into a rallying cry for others. Angela lost her mother to a heroin overdose 17 years ago, has adopted the children of several of her aunts and cousins who have lost their battles with addiction. After all this, Angela's son and his girlfriend have become addicted to opioids, and his girlfriend overdosed in Angela's home. Her son is still battling with heroin addiction. There are so many groups that are working to support these individuals, and we need to give them our support. But they cannot and should not have to do this alone. I really appreciate, I see my colleague, Senator Shaheen here from New Hampshire, her leadership on this. I'm a co-sponsor of Senator Shaheen's standalone legislation, which would provide emergency appropriations in order to combat the heroin and prescription opioid crisis facing our state in New Hampshire. And in fact, she and I have both written to Health and Human Services and asked them to designate this as a public health emergency because we've seen the impact in our state and we've seen the lives that are being lost and impacted by this. So I'm co-sponsoring I'm going to be co-sponsoring Senator Shaheen's amendment to CARA and supporting this on the floor. And I very much support her getting a vote on this, and I hope that that happens. In addition, I do appreciate that the president has put in additional resources in his budget to address this issue. And this is an issue that, as I look at, we all have to work together on. At the end of the year, there was also important funding that was passed that CARA would provide a very important framework for. Last year, during the appropriations process, Congress worked to increase by 284% funding for programs at CDC and SAMHSA related to combating opioid abuse. While this is a positive step forward, these dollars actually haven't been distributed yet. And so it's important that we pass CARA to make sure that as we go forward with the dollars that have already been appropriated, and as we go forward in the appropriations process this year, that we have the framework to properly redirect this funding to prevention, treatment, first responders, to make sure that we have the feedback of 130 stakeholder groups of law enforcement throughout the country to ensure that these dollars are appropriately spent to address the epidemic that we're facing. I was honored, and I have been honored, to work over the last several years again with Senators Portman, Whitehouse, and Klobuchar in introducing this bill. In fact, I also want to thank the head of drug policy in the administration, Director Botticelli, and he really summed it up well when we asked him about what he thought about CARA. He said in a hearing before the Judiciary Committee in January, there is clear evidence that a comprehensive response, looking at multidimensional aspects of this that are embedded in the CARA Act, are tremendously important. We know we need to do more, and I think that all of those components put forward in this bill are critically important to making headway in terms of this epidemic. The Comprehensive Addiction and Recovery Act would be a significant step forward in a federal response to this public health epidemic that is facing New Hampshire and so many other states in the country. I urge my colleagues to support this critical legislation, to listen to the people of New Hampshire and to the people of this country who are asking us to act. This is what they're saying in New Hampshire. In Senator Barnstead, please pass legislation to save my son's life. In Manchester, I wake up every morning with a fear that I will find my son dead, and I'm crying out for help. In Spofford, I want my voice to be heard so that no one else falls through the cracks. In Londonderry, addiction can happen to anyone. In Tilton, we need action, and we need it right now. We have an opportunity on this floor right now in this debate, and very thoughtful legislation, very bipartisan legislation, the Comprehensive Addiction and Recovery Act, to take action now. We owe it to all those who have lost their lives, their families who have been impacted, and those who are struggling with addiction, the first responders in our community, the people who are working hard to turn this around in New Hampshire and across this country. To all, I thank them for the incredible work they're doing. We need to pass this legislation. I urge my colleagues to join me in supporting passage of the Comprehensive Addiction and Recovery Act. This bill will make a difference, and I believe it will help save lives in New Hampshire and across the country. And no doubt that passing this bill will make a difference. We will all need to continue to do more. We will all need to continue to fight for more and more support through the appropriations process in any way that we can. And I intend to keep up this fight because I know that lives are on the line. I know that this issue is impacting my state. I know that this issue, as I talk to the mothers, the daughters, the fathers, the sons, the friends that are telling me the stories of the people that they've lost, that we can turn this around, but it is so important that we pass this legislation. And Mr. President, I want to again thank my colleague from the state of New Hampshire for her work on this. And with that, I yield the floor.